definitely after just a natural enhancement of my face. Something that people would look at me and say, wow, you look great today, you look really happy, like you look awake and really fresh, but they wouldn't necessarily say, gee, have you had something done? I think
All right, we've had a chat with Monica and now it's time to start treatment. So the first step will be to actually give her a bit of a formal assessment of her face. Overall, she's quite slim. If we look at her area of concern first, even though she's young, she could have a little bit of volume through the cheek here. You see there's a little bit of an eye hollow there, and you can see that improves the under eye hollows. So what I'll do with the filler is to actually put some filler right in that spot just there to make that support the under eye area. Because we're going to do the upper lip and the cheek, I might just give it a little bit of numbing in that area, so a little nerve block just to anesthetize that area, make it a little bit more comfortable. That should last about an hour. I'll start with enhancing your lips. So first thing, I'll just put a bit of an entry point in. Now I'm going to use cannula for the lips, which is, as I explained, a rounded tip needle, and that will find its way through the lip without causing too much trauma. The advantage of that, especially for lips, is that the swelling reduction is huge, as well as it reduces bruising. It doesn't eliminate it altogether, but at least you've got a reduction. Enhancing the red or the vermilion of the lip, as well as the border. So this is the philtral columns. Now they're sort of an A shape, so we've got to fill them along their natural line. I'm using a needle for this part to give that real nice Angelina Jolie effect there. I'm going to put a nice highlight right here. That's the beautification part of this procedure. For the cheeks, we're going to use a cannula again, and also we're going to use a fairly a thicker product than the lips, which lifts a bit more, but at the same time this product is quite nice in that it blends in really nicely with the rest of the cheek. A few injections in the forehead, so just little injections, and then a bit of massage just to mould the filler into the area. Forehead filler will tend to expand a little as it picks up a little bit of hydration over the next week or so. We'll just do a quick summary of what we've done. Starting from the top, we've filled in her forehead, a bit more on the right than the left. Moving down to the temples, we've filled in to make them more flat. Given her cheeks a bit more fullness with a highlight on the 5 point or the golden ratio point. Upper lip, the philtrums, which have given her a nice three-dimensional shape to the lip. A little bit in the lower central lip, and I think she looks wonderful. So thanks for being a good patient. And
Thank you, very excited. I feel fantastic. I feel like it's had a really positive effect on my daily routine. I don't have to worry about the little imperfections I used to. I'm definitely more confident.
Although she looked amazing beforehand, I think the treatments just made that subtle improvement to really set off her beautiful features. Her lips look full, but not overdone, so they still look natural. Her eyes look brighter, and certainly the transition between the eyes and the cheeks looks smoother. The cheeks look higher.
Although I love my lips, I think they're fantastic, I love my cheeks. I think they make me look really young, they make me look really youthful, they make me look healthy and hydrated, and all my family and friends have commented on that and the shape of my face. I used to touch up all my photos before posting them online, and now I've found that I haven't touched any up since. I'm really happy with the end result and I don't have to change anything now.